So there's a lot of different surgeries for, on the spine, and so not all of them are fusion by any means. There's a lot of decompression surgeries where we're opening up around pinched nerves. But in some people, they also have instability or looseness in their bones, so that the bones are moving too much or falling off each other, and sometimes that looseness can actually pinch nerves and cause problems. And so in those situations, then we do a fusion with it. And so basically what that means is kind of holding some of the bones together. So it's usually putting in some implants, some screws or something to stabilize the spine and make sure everything stays in place so that it's not going to fall apart. And so in that situation, there kind of classically has been two standard ways of doing that. One is an open procedure where we make large incisions and we have to directly see everything, so it's a lot more dissection, a lot more pain afterward if you're dissecting off muscles and things like that. And then you can directly place the implants because you're seeing a lot. There's more minimally invasive techniques and ways to do that, but that usually involves a lot more time in the OR, a lot more x-rays in a lot of different angles. And so the robotics is kind of taking that one step further and making minimally invasive surgeries safer. So it's certainly not as time intensive, but also it's not as required on having the great views on the x-rays and things like that. And so we can do with even less dissection on these things. And so we can put the implants in using our navigation system that basically guides us to tell us where exactly we are in the spine without having to see everything. And so by minimizing the dissection and minimizing the incisions, and it's a quicker recovery. There's less pain after surgery, so people can get back to their normal lives, back to work, back to doing things. A lot of people don't know all their options. I mean, they go in to see a doctor or surgeon or whatever, and they're told that this is your problem and this is how I can fix it, but they don't really know that these other things are out there in the community. And so, being aware that there are these newer technologies that can make things better and get you recovered faster, I think is critical. And especially when you have a team like we have here at St. Anne's, where everyone's coordinated, so you don't just get offered surgery. There's a lot of other good options we can do. So I mean, I think it's top in the country, and there's even some national groups that rank hospitals, and we're always way up there near the top, and that's why I've been so happy here. I mean, the whole system works hard to make sure that all the patients' needs are taken care of while they're here. So I think it's a fantastic place to have this stuff.